Hello there. Thank you for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue to have our conversations around the COVID-19 pandemic as it continues to ravage the world in its path. Today, we are very happy to have vaccinated over 150,000 people in Guyana, and we are grateful that we still have vaccines. Although we have a long way to go, we are on the right path heading in the direction of vaccinating our population. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. As usual, I'm starting off by wearing my mask to cover both my nose and mouth, but for the rest of this program, as we continue to chat, I will take it off. But first, I must introduce you to Ms. Tamika Rodney from HGTV Nightly News, who has graciously consented and asked to be here so that we can have a frank discussion about the COVID-19 pandemic, the vaccination program, and other relevant information regarding COVID-19 in Guyana. Thank you, Ms. Rodney, and thank you very much for asking me to come on today. We can take the masks off as we continue this program.
Thank you so much for having me on the program. My first question is in relation to the deaths we would have recorded in the month of April. Since the pandemic started, April would have been documented as the deadliest COVID-19 month. We have the vaccination program or the vaccination drive ongoing. I think it's in its third month now, but we continue to see an exponential rise in cases and deaths. Can you say what you suspect is fueling that?
Yeah, so we are in what we recognize to be the second wave. Many countries around the world had an initial first wave, including Guyana, and now after a period of some stability, we are in a deadly second wave. It is quite the same across the world. Many countries are experiencing the second wave. The link with vaccine is an interesting one for you to bring up, because what we have seen, I can tell you from local experience, that since we have started our vaccination program in Guyana, we would have had over 130 persons admitted to the COVID ICU in Liliendal. None of those persons that were admitted actually had vaccine more than 2 weeks. In fact, only 3 people had their vaccine, and they were all vaccinated within 2 to 3 days of being admitted. So they already had COVID when they got vaccinated. And this is quite in keeping with what we have seen across the world, that people who are vaccinated are not going to end up admitted to an ICU. They're not going to be ending up on a ventilator, and they're certainly not ending up dying. So the experience in Guyana bears out what we are seeing across the rest of the world, which is why it's important for us to try and vaccinate as many persons as possible in our population. You can still get COVID after you're vaccinated, but you're not going to end up in the ICU. You're not going to end up on a ventilator, and you're not going to die. If you get COVID after vaccination, it is likely to be a mild form of the disease. Although you can still transmit it to others, the chances of you doing so is also reduced. And this is why we continue to advocate, we continue to advise people to wear your mask, social distance, and sanitize as much as possible despite getting vaccine. Whether it's first dose or 2 doses, we still need to follow those basic, simple guidelines that are there for our safety and for the safety of those near us.
Understood. Thank you for that explanation. However, PAHO WHO would have stated, I think a few weeks ago, that the surge in cases, new cases and deaths in Guyana was owing to a suspected new variant. Do you also think that this is because of the current position we're in is because of a new variant circulating in the country?
It is very difficult to be certain about that because we do not have the capability of testing for the variants locally. In order for you to confirm that, we would need genetic sequencing. We'd need specific testing. To the best of my knowledge, that is only available at the CARFA lab in Trinidad and Tobago. So we're not able to be certain whether or not we have the variants that are talked about. And I want to spend a couple of minutes to elaborate on that a little bit. These variants, and there are about 4 major ones now, they have letters and numbers behind them, B117, etc. But let us think about them as country of origin or first recognition. We have the South African, we have the British or the UK, we have Indian, and we have Brazilian. These variants have been shown to be very different than the original COVID-19 when you look at them in the laboratory. But in practical terms, in humans, they are all very similar. Yes, there are a few separating properties, but in practical terms, the response to vaccine, etc., is pretty standard across. Now, our geographic proximity to Brazil will definitely put us at increased risk of cross-border contamination and, cross-infections, for example. So we may very well have persons from Brazil or the variant present in Brazil in Guyana because of geographic proximity. It is quite possible. Our borders are, quite porous. And for people who live and operate in the border regions, the border doesn't really exist so much. It's more of an arbitrary thing. Their daily lives cause them to move from place to place, and they may cross over from Guyana to Brazil, etc. And of course, with travel now into the population center from, the Brazilian border region, it is quite possible that the variants have made its way to the main population center. So we can assume, but there's absolutely no way so far that we know of that to confirm that we have the variants here, and these are the reasons for the surge in cases or the surge in death rates. If you were to look at countries that have had lockdowns, our neighbors in Trinidad, for example, they have had lockdowns for more than a year, and yet they're still experiencing a second wave, a second surge. They would have had 20 deaths in the last 4 days, and they're recording over 10, 11,000 cases so far. This is despite being in lockdown for over a year. So there's something more to it than just lockdowns, variants, etc. In medicine, we have something called natural history, and perhaps we are going through the natural epidemiologic history of this virus before it takes a change.
Does any of the vaccines we're currently using, Sputnik V, Sinopharm, AstraZeneca, do any of them protect persons against new variants?
So, interesting question, and very, very good that you asked this question. What we have seen is that these viruses and these variants are a lot more scarier in the laboratory, in the petri dishes, when you put genetic material versus other genetic material. That it gives you one result. But in real life, when it comes to people, the vaccines have still been shown to be protective. Even though we have seen that some of the variants, in particular, we'll talk about the Brazilian variant because it has immediate repercussions and implications for Guyana. But it seems to be more virulent. What I mean by virulent is that it's a little bit more aggressive in being passed from one person to the other. And it seems a little bit more aggressive in terms of getting people sicker in hospital. Okay. But the basic mechanism in which the vaccines work to reduce severity of illness continues to work even in the Brazilian variant. The countries that have been showing the catastrophic events of the second wave, there is a failure there for vaccinating the population rather than the failure of vaccines. Because in India, that produced the largest number of vaccines for the rest of the world. They did not achieve the level of vaccination for their own population that I'm sure they would have been happy with. And the same thing for Brazil. People in Brazil have not been vaccinated to the extent that they are happy with. We in Guyana are pushing aggressively with our vaccination campaign, and we're very happy to know that we've crossed the 150,000 mark. If we were to look at what we hope to achieve for herd immunity, essentially we're aiming for between 60 to 80% of the adult population being vaccinated. And that if you were to assume that we have about 500,000 adults, then that means we need to vaccinate fully 350,000 people to be about 70% herd immunity. So that's our goal, that's our aim. Of course, we would like to get 100%, but we will start with realistic targets.
Earlier you mentioned that the only way for us to determine whether there's a new COVID-19 variant present here in Ghana is by us sending samples to CARFA to be tested. There seems to be a hold up in that process. I recently asked the Minister of Health, Dr. Frank Anthony, about this, and he indicated that they're working out the arrangements to have those samples sent. But in the meantime, with no restrictive protocols at the airport system, we know the Brazil borders have been closed and so on, but we have variants or the possibility of persons coming here with with a new COVID-19 variant from other countries. Do you think that we should implement certain measures that can prevent that from happening, since we are not testing for that variant here?
So the only thing else that we can actually do is to stop people from coming in. And I'm not sure that that is the best option, because we see, even in places that have done that, in our neighbors in Trinidad, there is still a surge in cases. So I'm not sure that we have adequate and sufficient evidence to pursue that approach. Our situation is completely different. We're not an island surrounded by water that we can close off. We are part of a massive landmass in South America. And so our borders, we share them with Brazil, we share them with Suriname, we share them with Venezuela. People move across the borders. So it's almost an impossible task, given our resources, to shut us off from the areas of known traffic. The airport, yes, is one of those places that we have people coming in and out. The shipping ports as well. But we have put all of the measures that we think are reasonable in place. From the time that people are coming from their origin, they have a clinical screening, temperatures are checked, people are symptomatically screened, plus they have to produce negative COVID results within a certain time. And when they get here as well, there's temperature checks, there is screening as well, they have to produce their results. These are all good standard measures. And the next thing to do is basically to shut off the airports. But I do not believe at this point that we have sufficient evidence to go along that path.
Understood.
To our viewers and listeners, thank you once again for joining me on the program, Your Doctor in COVID. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.